Okay, so that first movement, that the hip flexion pike pulse that I was performing there, is an awesome movement that you can implement for hip mobility, not just hip activation and warming that area up, but it actually serves as a good mobility tool because we can feel tightness in our hip flexors, but sometimes that tight feeling can be a result of our brain protecting that area. If I live a sedentary life or I sit at a desk all day for my job, I'm in a chair like this and my hip flexors are in a shortened state throughout the day. And so my brain is going to protect that area by keeping those muscles in a shortened state, and that's going to feel tight. And so we can implement static stretching or getting on a foam roller and mashing the tissues of our hip flexors in order to free that area up. But an exercise like this pike pulse is effective at establishing a neuromuscular connection between our mind, our brain, and our hip flexors. And by taking it through these contractions and active lengthening motions of the muscle, it's allowing your brain to tell that area, or this area is actually giving the brain feedback that it's okay to release, it's okay to loosen up, it's okay to allow a full range of motion to happen here. And it allows it to free it up so that you can move efficiently. So you can add this in before you squat, before you deadlift, but you can also just do it after a long day of work if you've been sitting at a chair. And a few notes or cues from the video that I want to talk about. If you do this yourself, you can do anywhere from 2 to 3 sets or however many sets you want. Do like 8 to 10 or even 8 to 20 reps per side. But if you notice from the video, I'm giving myself some tactile cues here, and what I'm doing there is I am just trying to be mindful of my positioning for this exercise. You're going to have a leg straight up on a bench and you're going to have a leg down to the side, and you want to maintain an upright braced posture as you're bringing this leg up into flexion and extending it down to the floor again. And so the tactile cues, me changing my hand position on my torso isn't necessarily random. I am just allowing myself to be mindful, to stay braced, to keep myself from slouching as I'm bringing my leg up, to keep myself from leaning back in order to bring my leg up. And I'm working within my ability there, my range of motion, and what I'm able to do, but I'm doing it within the structure of, staying braced and in an upright posture. So give it a try and open up those hips.